Good morning, ladies and gentlemen. Good afternoon, good evening from wherever you're joining us from. I would like to warmly welcome you to the first edition of the Iif Webinar Series. My name is Maria Glover and I'm the projects lead at the Impact Investors Foundation. And we are a non-profit organization and our work is to focus on building a vibrant impact investing community. The theme of today's webinar is the impact of COVID-19 on Nigeria's social, economic, and political landscape. And I have with me three discussants who will be appraising the impact of the pandemic vis-a-vis all the various government and private sector-led emergency responses and the doom and gloom prediction, which is causing a lot of panics. And how do we save Africa's largest economy from going into recession? I imagine the panelists wouldn't have all the answers, but I'm hoping that today's session will be very interactive and we call on you to participate by asking questions, giving us your insights and the challenges you're facing as a result of the pandemic. Please use the Q&A box to leave your questions. And if you have any comments, please drop them on the chat box. And also we'll be putting some information and announcements on the chat box. So we have quite a number of participants in the room and would like to know you. So if you could open to another browser, what I'll do, I'll quickly put into the chat box the mentee website so you can click on it and open it. It will take you to a new browser. Let's get to know who is in the room. So bear with me 1 second. So the browser is on the chat box. So click on it. It will take you to another website, another URL. And please log on, use the code 961055. I'll call it in 961055. I'll drop that again on the chat box. We would like today's session to be highly interactive. We want to know you are there and you are participating. We have 25 people in the house. So I'll give you a minute to, all right. I'll share my screen now. Bear with me. Great. Neka Eze Dalberg, welcome, welcome. We'll give a minute. We have 26 participants. So it's coming up. Please put in your name and your organization. So let's recognize who is in the house. Chidima Chukuma, welcome. Innocent Chukuma, welcome. Osai, welcome. Raymond IIF Timitokwe, Egbe Osifo, welcome. Ezibidi, welcome. So we'll just give a few more minutes for others. Adesua, welcome. Who else is in the house? We have only 9 respondents. Victor, welcome from Social Capital. Social Capital. Megan Kieran, Acumen West Africa, welcome. Ime Joseph Upong of YTF, you're welcome. Okay. Dami Ogunleye, welcome. I see more names are coming up. Yemi Adamolekun, welcome. Enough is enough. Godwin Henry, you're welcome. Ayodele, SME Funds. All right, thank you. Thank you. Kola Fabiyi, CN. Okay, so let's go to the next question. Okay. Now, describe how you feel in one word this morning. How do you feel, whatever time it is in your region? Excited, great, great. Ready, I like that. I like the sound of that. Fantastic, wow, blessed, wonderful, happy, interested. Great, keep it coming. Anxious, expectant, open. A lot of positive vibe is coming. All right. Energetic, lovely, open-minded, curious, great, eager to learn. That's fantastic. Sleepy, oh. But I'm glad that we're all doing well and we're very expectant this morning. So I'm going to stop the share and we'll continue. Thank you very much. Welcome each and every one of you again to today's webinar series. Before I hand over to the moderator, I'll quickly put in a Google form on the chat box and you click on it and fill 3 key insights and takeaways you want to get from today's webinar. And also, if you want to go further, you can also put who will be implementing the takeaway, IIF, yourself, or the government, or whoever you think should implement the takeaways. We want to move from talking to actually taking actions. And we encourage you to complete that before the end of the seminar. So I'll quickly put that link on the chat box. Bear with me a second. So if you click on it, just have it ready. And as the discussion goes, you might want to just note your insights. We'll be sharing that at the end of today's seminar webinar. I'd like to hand over to the moderator, Ms. Uloma Ike. She is the Group Head, Micro Enterprise Division at Bank of Industry, Nigeria's largest and most successful development financial institution. She's a leading expert in sustainable finance with several years' experience in banking, micro enterprise, and development finance, and has worked with institutions such as Access Bank of Nigeria, Visa International, and IFC. So ladies and gentlemen, I'll hand over to Uloma.
Thank you, Maria, and thank you all participants. Welcome to the first Impact Investors Foundation webinar series. As Maria had stated, this is like the first one. The COVID pandemic has affected all aspects of our lives, right? And today we'll be discussing the impact of COVID-19 from a social, political, and economic part of all global economies. Today we have 3 great panelists. We have Yemi Adamolekun, Nneka Eze, and Innocent Chukwuma. One of the things we'd like this to be very interactive. So please put your comments in the chat box and your questions in the Q&A box. Yemi Adamolekun currently serves as the Executive Director of Enough is Enough, Nigeria, a non-partisan network of individuals and organizations committed to building a culture of good governance and public accountability in Nigeria through active citizenship. Yemi has a 20-year career spanning the public and private sector in United States and Nigeria. Welcome, Yemi. Thank you for joining us. Yemi, you're actually on mute.
Right. Sorry. Thanks for having me. Morning or good afternoon.
Nneka is the next panelist. Nneka leads Dalbert's work in Nigeria, where she's a partner and the Lagos office director, advising on strategic planning, market analysis, investment planning, and performance transformation. She has focused on a range of sectors, including agriculture, education, and youth employment. She has also focused on financial services and inclusive growth, and is a co-leader of Dalbert's Advisors Global Agriculture and Food Security Practice Area. Prior to joining Dalberg in 2009, Nneka was a consultant at McKinsey in Washington, D.C. Welcome, Nneka, and thank you for joining us. Nneka is joining all the way from the US, so I know it's still very early for you. Good morning. Our last panelist, who is the lone man amongst the women, is Innocent Chukwuma. Innocent is the Regional Director of Ford Foundation, West Africa. Before joining Ford, he founded the Clean Foundation, a non-profit organization that promotes public safety, security, and accessible justice in West Africa. He's a globally renowned advocate for human rights and good governance, and is the recipient of numerous honors, including the Reebok International Human Rights Award. Innocent sits on many boards and serves as the chair of IIF board. Thank you, Innocent.
Thank you.
So our first question.
Vice Chair, not yet. I'm not yet.
Our first question is for Yemi. Yemi, so without a doubt, the main thought of most Nigerians now is how to survive this period. And the government has stepped in to address some of the concerns of its citizens, right? What do you think, in terms of what the government has done, do you think they've done enough in terms of the palliatives? How would you measure what the government has deployed so far in responding to COVID-19 from a social perspective?
I don't think the government has done enough at all. And I don't think the government quite appreciates how its lack of data, or its lack of value or premium that it places on data, is part of the challenges we're having at the moment. We have a social register that I believe had 2.6 million people. In Lagos alone, you probably have 2.6 million people who fall below the poverty line. If you take Lagos State, as part of its own palliative, said it was giving support to 250,000 households. Meanwhile, a non-profit did a recce of an area in the Lekki part of Lagos and found 11,000 households who were below the poverty line. So if one NGO was able to do research and realizes that 11,000 people in one particular area, one small area really of Lagos, because it's just a neighborhood, need support, how much more in the wider scale of the state, you now say you are doing 250,000 households. So I just use that as an example, and we can literally multiply that across the country of how ineffective government has been in identifying even those at the bottom of the pyramid that need help. I mean, the governor of Kaduna, if I use an example in the north, stated very clearly that when they first did their round of palliatives, that they didn't do it well because it was a bit random, quite frankly. He now decided to work with the telcos, and they now started using those, the figure of how people charge their phones as a way to measure those below the poverty line. So they now started saying, if you charge your phone 100 naira, 300 naira, literally less than $1 per month, let's be clear, then that would qualify you for support. Again, a state that has innovated and tried to find a way to identify the poorest of the poor. So my point is, one, we don't have data, and we don't seem to recognize how our lack of data is stopping us from helping citizens generally. And then for small businesses, there's been CBN saying people should apply and they would give loans. I've received sort of limited feedback and how quite effective that process has been. So in summary, really, I would say no, that the government hasn't been effective, and underlying that is a lack of respect for the use of data in deciding how to give your people money. People parallel to the US and Canada, people are getting checks in the mail because I know where to mail the checks to. People are paying taxes. So there's a record of who you are, how much taxes you've paid. And I think the US is literally an advance on the tax you would have paid this year anyway. So I'll leave it at that.
Thank you, Yemi. I think you've brought up one thing that is critical, which is the need for government to improvise. In other words, we don't have the data, but we're not going to just sit down, wait until we have the data. So you've brought up the topic, the fact that, you know, some state governments have been quite innovative in the use of a different type of data to get the results that they want. Thank you. The next question is for Nneka, and we're looking at this from a business perspective. You know, one of the things that everybody has been talking about is that, oh gosh, that this is going to be, there'll be so many doomsday predictions about the impact of COVID-19 on the global and Nigerian economies. The recent Dalberg's report on the economic impact of COVID-19 in Nigeria presented a two-case scenario. One was the moderate scenario of a drop of 4% in GDP, and then the worst case scenario of a 23% reduction in GDP. Can you speak a bit more about the scenarios and what governments and businesses should be doing at this time to prepare for this worst case scenario?
Thanks, Saloma, and good morning to everyone. I think one of the things that was made very clear to us is that the health impacts are very important, particularly given what we've seen in terms of the international situation around COVID-19, but really that the economic impacts could have potentially more significant effect on individual livelihoods and particularly on MSMEs. So what we wanted to do is understand what could potentially happen to the Nigerian economy. So we looked at two different sort of comparators, if you will. One that looked at the Ebola virus disease impacts in 3 countries in West Africa to understand effects of things like lockdowns, as well as shifts in movement and consumption due to a health at that point epidemic. And then we also looked at past recessions in Nigeria to understand how the economy had been affected through previous recessions, previous contractions, and given global oil price dynamics. So in the moderate scenario, which is the sort of 4% or so reduction, there it's really about the question of what's going to happen with declining exports given the global recessionary pressures, as well as limited demand, and hopefully a more contained COVID-19 situation, as well as a lot depends on the oil price. And then in the downside scenario, which is a 23% reduction in GDP, it's really about a longer timeline in terms of managing the COVID-19 pandemic, oil price wars persisting, currency continuing to depreciate. And I think the question about how much we can sort of support the currency and the potential for high inflation there. I think taking a step away from the actual scenarios, the question about what does this mean for businesses is quite important. I think it means that businesses are very vulnerable, particularly when we look at the composition of MSMEs in the economy, where they're employing over almost 80%, I think 77% of people, contributing 50% of GDP. So I think MSMEs will be most critically affected, and especially those who have low savings or had low savings before some of the lockdowns. I think even if we just look at some of the mobility data that exists out there, just by closing Lagos, you saw significant impacts in terms of reduced traffic at retail locations, at sort of the various different types of MSMEs who really drive those sectors. And so I think the impacts are going to be quite great, not just from the economic lockdowns, but because when people are getting back into business, some people are still going to be staying at home and people's income is going to be reduced given what we've already seen around some layoffs, as well as reduced incomes during this period. So I think for businesses, it's all about understanding what your cash situation is, seeing what type of partnerships you can strike during this time. But unfortunately, and I think as Yemi highlighted, the government interventions are not really enough to cover everyone. And so I think it is going to be a lot of sort of self-perseverance, as has often been the case, but hopefully some potential for collaboration with other businesses to at least get through this period of time. I think there's some discussion about what a one-year support might look like to MSMEs, and the hope is that that comes soon.
You're on mute.
Yeah, it sounds like, from what you're saying, it sounds like we're really looking at the 23% reduction in GDP. I think that's, we should stand for that.
Yeah,
Not
you
the
know,
focus.
it's interesting. When we first did our analysis, it was right around the time when the World Bank and original estimations came out, and they only looked at the Ebola virus disease as well as some of the global impacts on accommodation and aviation sector. And there it suggested like a 4 to 8% reduction in GDP. But over time, over the last couple of weeks, there have been new projections which suggest sort of each new projection suggests a lower and lower number. I wouldn't feel comfortable saying we know it's going to be 23% reduction in GDP, in part because there are opportunities for both the government and philanthropic capital potentially to help sort of assuage some of the reductions and sort of the recessionary pressures. But I think the big question is how quickly can we get COVID-19 under wraps, because the lockdowns very much affect people's livelihoods. And secondly, given the global recession, what can we do to support the sectors that can grow during this period? Things like agriculture, things like local manufacturing, to support at least some amount of production, employment, and local demand.
Thank you. Our next question is for Innocent. I think these are really interesting times. Citizens are watching the handling of the crisis by their respective governments, right? And Nigerians are not left out. Most governments are exploiting this pandemic to demonstrate ability to manage crisis. What do you think will be the impact of COVID-19 on the famous 2023 elections?
I think the first thing to say before I answer the question is that nobody, no group, no political party is responsible for this pandemic. It's not anybody's fault. However, how governments, parties, and groups have responded to it is perhaps what differentiates country A from country B, from party A to party B. And coming down to your question, I would say, depending on how this pandemic pans out for the rest of the year, and perhaps 2021, it may not really impact the politics and the outcome of 2023, because politically speaking, 2023 is too far away from people's horizon. A lot of things can happen in between to change people's perceptions and inclinations in relation to who they support or which political party they align with in campaigning for the election. What one hopes is that the behavioral change that is beginning to emerge within the public health sector and public consciousness, one hopes that it will be extended to other sectors, especially our politics and the way we elect our leaders, which in my view right now is still dominated by primordial considerations, ethnicity, religion, and all of that. But what this crisis has shown is that if you don't make the right decisions in terms of choosing the capable people and political parties that will better represent your interests, whether the person comes from the next door to your home, you are going to face it rather severely. And I will also suggest that what will determine whether we will have the kind of impact that you and I perhaps may hope is that we require political realignment. We need to understand that this country belongs to all of us and that we need to put our best foot forward, and we need to select on the basis of ideology, values, and principles that parties and individuals represent, whether they are aligned with what we believe, and then aggregate along that line. It also requires civil society to actually go beyond the neutral claim that we all make. I'm not saying that we should go ahead and be non-partisan, but on issues of ideology, on issues of values that parties and individuals represent, we can't afford to be neutral. And that is the way it is done in other parts of the world. Look at the NGOs in all Western countries. They may not openly say it is this candidate, but they know the parties that represent the majority of the people that they fight for in their daily life. I think it's high time we started, playing that type of politics and begin to see civil society and political affiliations beyond the professional class of NGOs to look at the labor unions, look at the informal workers, look at farmers' cooperatives, because in the past, civil society definition used to expand and incorporate all these sectors and work in a much more collaborative manner to know that what we are up against goes beyond what one organization can deal with.
I think, Innocent, you brought out a lot of interesting points. I think one thing that struck me really is the question of ideology, right? The fact is that do parties really have ideologies? You know, can people actually say, this is what we know this party for, or this is what we know this other party for? So I think that's one of the things that probably is going to be brought out more and more to light as a result of this pandemic. My next question is for Yemi. So Yemi, you mentioned something about the governments, other governments, particularly in the US, they've taken steps to alleviate the social impact of COVID-19 on their citizens. I mean, the US has enacted a stimulus package where checks of 1,200 has been going to American taxpayers, and the UK also has implemented a plan to pay 80% of wages up to £2,500 for workers who lost their jobs as a result of this pandemic. So what do you think the Nigerian government should be doing at this point in time, given the fact that there's been quite a lot of job losses, right? And this job losses, I mean, this is just the start. We haven't seen the end of it. So what do you think they should do apart from the palliatives that they've been handing out at the various levels?
Number one, it needs to be a bit probably decentralized. There are those who pay taxes. As I said, our tax structure is quite weak. So even those who are taxpayers, I think one of the sort of flip-flops, if I remember correctly, was an initial tax break that were given to companies. Then suddenly there was like, oh, telcos, you are making a lot of money, please pay your taxes on time. So I think for me, that sort of symbolizes the lack, a non-cohesion and sort of clarity around what is it that we're trying to do. So yes, telcos are making money because as we're here, we're able to connect via their services. But I think sort of a deeper, and the same telcos have donated £1 billion to a private sector fund. But I think some holistic view of what services can afford to pay taxes, what does that look like? And it's not just telcos, there are other businesses, essential services as we call them, that are also operating. So there's some clarity around what kind of benchmarks are we giving to that. As they're easing down on the economy, they're also allowing other parts of the economy to work, to function. So construction, for example, is one that has started. Now for small business owners, I think the key for small business owners is the ability to continue to work, to continue to produce, to continue to pay people so that people continue to have a source of income. So what is it that you can give to small businesses that allow them to continue to produce in an environment where you don't have full return? I mean, my office, for example, is closed till the end of June, possibly till the end of July. So if I take my team, we're sort of out of some part of the transportation sector, if I want to use that as an example of income in that regard. So I think it's really just taking each sector of the economy and saying, what is it that's peculiar to this sector and what is it that we can do? I've seen some moves, for example, the arts and entertainment industry. There was a committee that was set up and they sent out a survey to those in the industry to basically say, what are your needs? What would work for you at the moment? It'll be interesting to see what the results of that that survey would be. But I think underlying that really for me is just that it's very piecemeal. So if I was going to say anything, it's just that there needs to be more coordination around addressing the specific needs of sectors given where we are now, and also allowing states based on their own peculiarities to allow parts of the economy to function as it may be.
Thank you, Yemi. But when you mentioned about states, right? Yes, so states coordinating among states. But that if you look at the grassroots level, it's really the local government, right? Do you see coordination between the states, in terms of the states and the local government, in terms of the incentives or palliatives to the citizens?
Well, sort of two things. When I was speaking about, we're talking stimulus packages. So at least from where I sit, stimulus packages would have to be either federal or at the state government level. Mm-hmm. But you're quite right. Local governments are key in terms of data for and connection with citizens in the social services area. So if you take Lagos State, for example, when the governor spoke, I believe on Sunday, he said their new strategy literally was that only critical cases would come to the isolation centers, and they were going to start working with local governments and the primary health care centers, so that if you feel a bit unwell and it's not major, it's either you're asymptomatic or you have mild symptoms of COVID-19, that you are managed at that level. And you're right. I think over the years in Nigeria, the local government tier of government has been emasculated, if I want to use that word. Their funds are controlled by the states. But last year there was a judgment that money should go directly to the local government so they can manage their own resources and their budgets themselves. I think it's only a few states that do that. Not all the states are compliant. So for states that do, I think this is a great opportunity for citizens in particular as well to focus on their local governments. The constitutional role of local governments include primary healthcare, include markets, include education. And these three areas are critically affected by COVID-19. Kids are at home, and at that level, children don't have access to internet. So the private schools that are doing Zoom classes and Google Meets and all those funky things don't apply for those at the bottom of the pyramid. Some states are doing radio and TV, but that kind of requires you to have lights or access to buy batteries, or if you didn't have a radio before. So there are challenges. And education, squarely local government remit. Markets, these are part of the challenges of gathering. How do you coordinate or manage people coming into markets, getting out, and be safe as best as possible? And then thirdly, primary healthcare centers. A lot of them are not functional. So for the states to want to then use them now as primary points of care means they have to invest significantly in ensuring the resources and the personnel to get the work done. So I think in fairness, it might actually work well for local governments, but again, this is Lagos. In Cross River, as a counter narrative, the state governor wrote local governments to donate to a state fund to fight COVID-19. So whereas you should be empowering your local governments who are closer to the people and can quickly respond, you are mopping up funds from them and taking it up to a larger fund to do what I'm not quite sure. So yeah, it's definitely an opportunity for citizens to engage and really demand accountability and engagement at the local government level.
Thank you. Nneka, this question is for you. So the Nigerian government has deployed several interventions, such as the 500 billion COVID-19 intervention, interest rate reduction, and some banks as well have actually done like a moratorium on repayment of principal or interest rather for SMEs. Do you think this is adequate given the fact that currently as a country we're facing two economic shocks? We're facing a drop in oil prices and also COVID-19. How would you appraise the interventions in response to the pandemic? It seems like a lot of questions.
Yeah, in a way, I think Yemi had answered some of this. I don't think it's enough, and I think she gave some examples of the international situation. One of the challenges, of course, is what is enough in the context of what do we have available in terms of the different measures. So she mentioned the challenges around tax revenue. I think the big challenge is actually around our oil revenue, and given that it is a significant funder of our government expenditure with oil prices as low as they are, we don't really have the pool of capital or pools of capital that perhaps we had historically to tap into to help get us out of these type of recessions or economic slowdowns. So I think in a way it's not enough, but I'm not sure that the government is the actor that's going to have enough resources at this time. And I think that's, something we have to just be very clear on, that the government, even with, if you look at the $3.4 billion that was received from IMF, essentially calling back our past payments into IMF over the past few years, even if you were going to disperse that to 30 million people, it's not a lot of money in the end of things. So it's not really a lot of money per person, just given the size of the economy and the number of MSMEs that we're talking about. Nigeria would need a lot more money than it has at present in order to fund these type of facilities. So I think it's a starting point. We saw that many of these facilities have already been very much oversubscribed. And so I think the question is, how can we mobilize other types of capital through different types of credible vehicles and use existing CSOs and others to help with some of that distribution for different types of credit facilities, different type of grant facilities that need to come up.
Thank you. This is interesting. Other types of capital. I guess something that we have to look at. Okay, the next question is for Innocent. What do you think will be the impact of COVID-19 on the approval ratings from the way that various governments have, at federal, state, and local level, have reacted? And we, like Yemi said, we have some governments that have been very active, very responsive, at least to their citizens in terms of information. And we have some governments that have been quiet. So what do you think would happen? What do you think will be the approval ratings, and how do you think this will be of any effect in terms of the governments?
To be candid with you, I think the impact on approval ratings will be very, very minimal, in the sense.
Sorry, I didn't get. Will be very what?
It will be very minimal, if anything at all, because the way the states have responded to the pandemic in quite a cavalier manner have created an asymmetry in terms of what are you assessing state A with in comparison to state B. Let's take, for instance, Lagos State, I would presume, in a spectrum, is on that tangent of states that want to test a lot more people, discover more infections, which will push them to be responsive, both in terms of offering treatments and also offering palliatives to those that are affected by the lockdown. Whereas in other states, take for instance the other polar opposites, which are Cross River State and Kogi State, the messaging, the public communication of the government is that, look, we don't have infections here. We are some kind of exceptional compared to the other states. Don't allow these people to bring this virus here. You are doing quite fine. And out of ignorance, people are buying into it. In the East, there are all kinds of exceptional claims. We survived Biafra. What is COVID-19 that we will not survive? So if you use COVID-19 alone to assess them, they'll say, look, we're actually doing quite fine. The fact that we have very few confirmed cases shows that whatever our government is doing well. It's actually in the states that are much more open and transparent about it that may actually get, if you like, backlash. Because we have seen in Lagos where the governor is every day communicating the level of infections, how they are responding in terms of palliatives. And then the feedback from the people is that even though you are doing something, but it's not enough. And people are feeling that the fact that they are not getting it means that the government is not doing anything. So for me, what I would want us to return to in terms of shaping how this pandemic will actually help us get something significant out of our politics is that right now we're still steeped in what I call a clash of personalities. We want to move away from this kind of politics about the way we are comparing the individuals of who governs and who is elected to a bit more where we'll draw them into where they belong in these two, if you like, divisions about how states respond and government respond in situations like this. So you have on the one extreme, the minimalist government that says, oh, let private sector drive development, drive assistance, let the market solve all the problems. And then you want to find out from them to what extent have they created the environment for the markets to lead that. And then on the other extreme, you find those who said, interventionist states, which if you look at the 2019 election, it was posed in some ways that way. For instance, Atiku came with smaller government, private sector-led development. And then APC under Buhari let the state, do it. We are going to create 25 million jobs. We are, borrow more money and all of that. So if we put, these are the two promises they made, and you look at the PDP states, to what extent have they been enabling of businesses? If what Wike is doing in River State is anything to go by, where he's actually locking up businesses, is that how private sector is going to lead the development? And then you look at the APC state that say, hang on, the state is going to do a lot for you. To what extent have these palliatives gone around? And to what extent did they actually factor in the interests of the people before they came out with this lockdown policy? Because if your government is an interventionist big government about people caring for them, we see how it's done elsewhere, where public health is, rendered free of charge, where government actually pay people money on a monthly basis. We're not seeing that. So that's the kind of debate we want to draw these governments into. What do you believe in? What is driving you? And then we can have some level playing field to assess them based on the result that they have shown through the implementation of the various policies that they are putting before people, and then use those to vote in 2023.
I think that's a different perspective, especially the area of over-communication. I mean, I think my assumption prior to this time was that the constant communication was good and also helping the citizens to shape their decisions. I think, okay, so I have one last to
we're losing you.
Sorry, I said I have one last question before we go to questions and answers, because I see there are quite a few questions and comments, right? But I'd like us to imagine what the end of COVID-19 will be, because clearly there's not going to be some day that we wake up and there's no COVID-19 anymore, right? There's a gradual process of containment. So what would you define as the new norm in post-COVID-19, right? What would you define in terms of election campaigning, grassroots mobilization, where we're used to having rallies? How will this affect our choice of leaders, given the fact that it's not likely that we're going to have all the rallies that we used to have before? What is the new normal that you see?
Is that for me?
Did you hear?
Oh, Innocent.
No, it was for Innocent. Should I say the question?
So if no, I understand the question. The new normal for me, I'm going to communicate it in terms of hope, because I'm in the business of marketing hope. I hope that the consciousness of efficiency that we are beginning to see, especially in the private sector, in the use of resources, between bringing people in a physical space and paying all these fancy hotel rooms and flying people business class, and using technology to achieve the same thing that we're doing here, which government is moving in that direction. And if we also use that to say, okay, the states promise the citizens this way, we are going to do, if for instance, we stick for a second on interventionist state, you want to provide more jobs, you want to provide increased healthcare, housing, and all of that. If the state leading on it, will it be more efficient to say bring in private sector actors, especially those of us in the impact investing space, between the state using its resources to do this and incentivizing impact investors to respond to these social problems, respond to social service needs of the people? Which one will be much more sustainable, impactful, and scalable at the end of the day is the kind of consciousness I want to take into post-COVID-19 era. The whole idea of questioning the effectiveness and the efficiency of the proposals, the policies that are being put forward for us as citizens to debate. And then another new normal for me will be a civil society that looks at whatever government policies, whatever government programs and use the lens of ideology, the lens of values. Not that this leader is incorruptible, this leader is of high integrity, this leader is a promoter of national unity, and then we go and throw in our votes. At the end of the day, we ask ourselves, what did we just do? So we also use that in educating the populace we interact with, the beneficiaries of our services, so that they can become critical thinkers that actually look at government policies and say, this is pro-people and this is against people, and begin to tag political parties and leaders along that line. This is a party that wants big business to take over society. This is a party that is actually pro-people, but even within that pro-people orientation, is the government the best vehicle for delivering it, or can you bring other actors, impact actors, social actors, and have a medley, a salad bowl of options for delivering the same goal of satisfying people's social needs? That will be the new normal, I hope, will come out of this COVID-19 crisis.
I mean, that's definitely a different normal for us. And with that, I think I'll draw the question. The next, I would like Yemi to talk about this. I mean, in light of what Innocent has said in terms of the new normal, citizens' engagement, you know, what do you think will be the new, or what do you imagine will be the new normal?
I'll start from where Innocent left off in terms of what he hopes to see. And I think there's, at least for now, is where we need to start pushing for that. So you take the private sector that received, I was just looking at the list, early April that received 3.4 billion or so in funds donated. And I'm wondering how the private sector received that amount of money, but there's no accountability. So we talk about government and government not being accountable, not being transparent, but some of Nigeria's wealthiest individuals and some organizations, churches and other private sector organizations donated money to this pot. But at least from where I sit, I haven't seen anything that's tracking how this money is being spent on what and how and what the protocols are. So to Innocent's point about how does private sector, through sort of different creative ways of supporting government objectives, begin to think differently about deploying resources. And we don't even see it now. And at least as he was talking, I was like, that's something that we really need to begin to advocate. That to be able to engage government on that level, private sector has a very unique opportunity to lead by example, if I want to use that word. There's only, I think, one organization, Citizen for Citizen, that was started by the chairman of First Bank that actually gives a public record of how they're spending money and disbursing it. I haven't seen any other organization do that with public funds that they've collected. That's one. Two, to your point about rallies, do I see that changing? To be honest, if a politician calls a rally today, people will show up in numbers, without a shadow of a doubt, across the country. They will show up in numbers. So because also, to the point about communication, I don't think, I mean, Innocent said maybe over communication, but I don't think maybe we're communicating correctly and rightly to the right audience. We saw the crowds that came out into banks. We saw the crowds that have come to markets. We see the crowds on the road. So the understanding of COVID and how it affects or should affect how we gather and how we do business and how we engage hasn't fully settled in our normal, so to speak. So to a large degree, things are still the same. However, though, I think it behoves on institutions to begin to frame how people come to you. So for example, as I said, my office is closed, so you can't come to my office. So I've, in a sense, by my own choice, I've limited how you access me. Before this call, I was on a call with other civil society organizations that do election work. And INEC was trying to figure out how to have meetings with stakeholders. And we had to tell them that you can't be thinking of a physical meeting because one, it will only be open to people in Abuja, unless you want to then have physical meetings in your local offices and then connect everybody via Zoom. But again, when we think technology, from a phone call, SMS, WhatsApp to Zoom meetings, that's the spectrum that different agencies of government and political, in terms of citizen engagement, need to begin to pay attention to. So you reach those who have internet access to do fancy calls like this, to those who you'll have to pick up the phone and call and engage. And then lastly, also shows the importance of data. Because as long as you can't do large gatherings and mass gatherings, you then need to be able to touch base with people where they are and how they can be, reached. And lastly, leadership. I think very much so the cue that we're taking from public leadership is extremely important at this time. It took a public outcry for the president to see the importance of addressing Nigerians. And that sort of, even though the PTF is doing their daily briefing, in a time of a crisis, you need a public face of someone in authority who basically is communicating to you, we understand this, we're on top of this, and we're doing the best that we can for you. And even if you look at the different states, you can see the difference between where you have the executive and the health commissioner who are working together, or in states where you don't even know the name of the health commissioner. It's only the governor of the states that you see. So the different dynamics of that, I think, also speaks to where we are. And from Innocent's point, if that is communicated and used to leverage political thinking and education, it should hopefully affect our outcomes when it comes to elections. Thank you.
Thank you, Yemi. I mean, but given the fact that I just want to, there's something you said about the, the COVID, or rather the private sector interventions, right? And there's been no accountability. But given the fact that even the professionals haven't asked for it, people in the private sector, not to talk about, let's look at people in the rural areas, nobody has asked for any form of accountability. So really, is it really the private sector's fault, or is it our fault? And this is us, that we have access to internet, to technology, to ask questions. We haven't done that.
Well, I disagree slightly. I mean, civil society organizations have been calling out CACOVID for lack of accountability, asking for a public, either a website that shows how much money you've gotten and how you're spending it. So that's been going, but I don't think it's been as forceful. But I think to your point, the stronger point is that even the people that donated are not asking. At least that's what I haven't seen anyone sort of say, would like to know how you're doing it. But also the maybe sort of subtle way that lack of transparency and accountability has become our norm. So that even when we can ask people that you have access to, i.e. private sector, to be accountable, we're not doing that as much as we should, because we're used to not having it. So even civil society organizations are the only ones, at least that I've seen, who are asking, okay, and especially because of the confusion, there was some sense that the monies were given to government. So it was actually even framed around government to account for the money gotten from private sector. But from what I understand, CACOVID money was just housed in central bank, but it's not the central bank that's dispersing it. It's the committee of CACOVID, that is, which is made up of private sector players and development players. I think Dangote Foundation, ACT Foundation are sitting on that committee. So the request should be directed to them, not CBN. And that's why I said that in Innocent talking about it, actually reminded me that we need to amplify the noise and really speak directly to the foundations involved. Asking Dangote directly, Dangote Foundation, ACT Foundation, you've gotten this money, how are you spending it? Can we see an account?
Thank you. The next question is for NECA. And for NECA, still the same question. What is the new normal in terms of business engagement? What do you think about the sectors? Because obviously some sectors will die off after post-COVID, right? What do you think is the new normal? It's not likely that anybody doing business development will go to offices. So how do we make sure that we're not alive, we're alive, but not dead from an economic point of view, because everybody needs some source of income and we need to grow our economies.
Sorry, was that the end of the question? Okay, I think so.
So the question is, what do you see as the new normal?
I got it. Sorry, the end was abrupt, I think, because of the mute. No problem. I guess one thing is that you're right. There are sectors that are going to be deeply impacted by COVID-19, and some will be positively impacted in some ways. So things like potentially healthcare. Although in other markets during health crises, we've seen already things like immunizations reducing and increases in infant and maternal mortality, HIV, AIDS, malaria deaths, and case burden, in part because people aren't going. So we'll see what the healthcare impacts are. I think potentially local manufacturing could be a winner, especially agro-processing if we're able to continue to consistently provide electricity and really focus on reducing the cost of electricity over time. Potentially digital industries, I think a lot of that depends on how much they're able to invest in increasing their bandwidth and their coverage across the country. And those are what we call the new winners, if you will. And then there's a range of industries that are going to be in more of what you might consider a hibernation mode, where demand is really affected by these short-term shocks, but then will hopefully start to recover over time. So restaurants might be considered in this category, where probably over time people will want to be able to go and eat outside of their home or to buy from a kiosk on their street. But for now, perhaps the demand will be a bit reduced. And then there's a range of sectors that maybe will have longer recoveries. So these are things like heavy manufacturing, in part because we're looking at the global recession and things like inputs that are required that need to come from other markets. And then managed decline, we call this sectors where perhaps we won't see the same return. So things like business travel. I've mentioned this in past webinars, that Abuja-Lagos sort of flight route. I don't know what that will look like, but I think there's a lot of people who are concerned about traveling in the midst of a pandemic. And I think the life that they start to lead during the pandemic, and even as the pandemic eases, might suggest that they want to reduce business travel in some ways. So I think there's a lot of reflection on that. And so that means that aviation, hotel, sort of tourism sectors likely will be impacted for a much longer period of time. And so I think it's a question about what then can be done for the sectors like agriculture, agro-processing, and others to bring them back to light. And then in terms of, I guess, what's the new normal for the individual citizen, in a way, the population of Nigeria, if we think of the broader population, has been suffering for so long in some ways because of the high levels of abject poverty. We have the largest population of people in abject poverty in the world, and the largest absolute number. I guess it's hard to say that their lives are going to change considerably. And I guess my hope would be that COVID-19 puts a spotlight on the significant challenges we have in the country, particularly around the structural and systemic inequality, and that then we can start to actually address these issues and see what sustainable solutions can be built on top of these immediate sort of philanthropic and other responses that can really affect change in people's lives day to day.
Thank you, Nneka. I think one of the clear things that COVID-19 has put a spotlight on is really the lack of healthcare facilities that we have in Nigeria, and the fact that, we know for a fact that if there was a full-blown effect of COVID-19 in Nigeria, there's no way that we have enough healthcare institutions to even take care of us. So I think that's a very good point. The fact is that all the sectors have really been underinvested in, and this is just showing, it's just showing the fact that there's been lack of investment for a lot of years. So I'm not sure that post-COVID-19, things are really going to be quite different. But I think now I'll just open it up to the questions. We have a number of questions from the participants. I have a question for Yemi, and I don't know who it's from. It's saying, Yemi referred to social register. How do you think Nigeria can benefit from a unified social register as opposed to several registers like BVN, NIMC, voters registration, driver's license, etc.? So that question is for Yemi.
Do you want me to go ahead?
Yes, please.
To be honest, the starting point is just political will. I remember under President Obasanjo, Malam El-Rufai was put in charge of a committee to synchronize data. I think at that time was immigration, INEC, I think like four other sources of data, so that each Nigeria has one sort of singular identifier. At that time, he also wanted to bring in what happens in Dubai, where your card can also be a payment card as well. So in terms of distribute cash transfers, it can automatically be done to people's cards that they can then use to either withdraw money from an ATM. So the big factor, honestly, is political will. So right now, there probably, if I'm not touch points of biometrics, you have your license, you have your passport, you have your voter's card, you have NIMSI, and even telcos do biometric. So, but we continue to invest significant resources and continue with NIMSI and tying NIMSI to BVN. Okay, I've forgotten BVN as well. And tying NIMSI to BVN without having identified that this will be our singular source, give ourselves a deadline or a timeline for how do we integrate this data without necessarily having to have people do it again. If I've done INEC and INEC has my fingerprints, why do I need to give NIMSI again? Or why do I need to give a bank? So that really is the challenge, the political will. And even while that might be a challenge at the federal level, I believe that states have the opportunity, if at the federal level we refuse to get our act together, for states to do something similar, to even understand who is in your state, because it allows you as a state to plan in terms of where to put schools, where to put hospitals, for things, as we discussed earlier, that are at sort of local government level of implementation. But again, I'll use Lagos State again as an example that I'm familiar with. During this whole bit about palliatives, they were able to say that in their database, they only had 200,000 people over 60. And I mean, the joke of that for me was like, and this is what? But we were locked down for 4 weeks or 5 weeks. At no point during that lockdown did the state make an attempt to collect data. Meanwhile, you are giving people free rice, giving them gari. So you are going to communities, you're going to people's houses, you're doing door to door. It was a perfect opportunity, since we refused to do a census, to actually use that to figure out where are your needy citizens, who are they, where are they, and collect that data. I haven't seen any state use this opportunity to collect data they can then use, because until we accept the fact that we don't have it, understand the importance of it, and then have the political will to do something about it, we'll need to have these challenges. And it's not something civil society can help with. Government has to count its own people.
Thank you, Yemi. I like that part. It's not something civil society can help with. So the next question, I think this would be for Innocent and Nneka. It's a two-part question. It says, it's from Dami Ogunle. How do you see the current combination of COVID-19 and oil prices affecting the private and institutional investment climate in Nigeria, right? I mean, I think this would be for Nneka. And then the next question, also from Dami, is what impact, positive, negative, will these issues have on impact investment in Nigeria? What sectors do you think are potentially attractive for impact investment at this time? So maybe Nneka will answer the first question. Let me just say it again. How do you see the current combination of issues, COVID-19 and oil prices, affecting private and institutional investment capital in Nigeria?
Yeah, it's a very good question. From my perspective, there's a few challenges, I think, that are there regardless of COVID-19. I think one is a question of, can you get, what type of returns can you get from Nigeria? That was pre-COVID, that will continue to be the case during and post-COVID. We've already seen, in terms of the global market, significant shifts in terms of equity capital markets. And even if we look at Nigeria, international investors have essentially fled the market. So I think there's a question about what would we need to do to inspire confidence and to get investors to come back into the market. I think the other challenge, though, is that Nigeria, always we're in competition, but especially now we're in competition with other markets who potentially have better managed their initial response to COVID-19 or are better investing into things looking towards the future. So one example is last week, Rwanda released their digital strategy, essentially saying, we're already needing to pivot. They had really focused on MICE, which is the sector which includes the meetings and the conferences, entertainment, and those are going to be deeply affected by COVID-19. So how do we think about pivoting whether it's using some of those resources or our sort of economic potential to now say, how do we get the entire country digitized and shift into digital sectors that will sort of support our next growth period. That strategy was released last week, and they brought many people together from across the country using Zoom. I haven't necessarily seen these type of big strategy shifts, and obviously Nigeria is a large country, but let's say pick one state to say, how does our economy look like 5 years from now based on what's happening during COVID-19? I really haven't seen that type of investment or shift. And so then if we compare to Kenya, for example, who released some strategies over the last week or so, their presidential task force, et cetera, looking more forward, and you're an international investor saying, okay, which country do I think is going to more quickly come out of the likely recession? You want to see some sort of strategies in place, and you want to see the numbers of COVID cases start to reduce. You want to see some things to give you that confidence. So I think the next few months will be very important in terms of how we're compared to other countries in Africa. That said, we still have the largest population. The challenge is, will we still have one of the largest economies given oil? So I guess what I'm saying is there's potential, as always, in Nigeria. It's now just a question of how can we get ourselves organized on the health side as well as on the economic side to really attract and inspire investor confidence. And I think that's not just international investors. I think that's domestic investors as well, who are looking to see what's going to happen. Should they be putting money into a stock market that likely will have negative returns this year, et cetera? So I think there's a question about how to inspire that confidence.
Great. So if I can come in here,
I think one of the...
Go ahead.
No, please go ahead. Go ahead.
Okay, so I was saying that Dami already identified that there will be positive and negative impact of COVID-19 and the dramatic fall of the crude oil price on the people. If one starts with the negatives, we already are in a system where sharing the benefits of the proceeds of oil exploration in Nigeria has at best time been a challenge. The people face disproportionately the adverse impact, but the proceeds in terms of the resources are hardly used to benefit them. But it will even worsen now that the proceeds would have dwindled by the time government shares with the oil majors who are bearing the cost of production and all of that. Very little will be left for government to use to invest in things that have social impact. But on the positive side is that if we look at what this government has done in the last 5 years, it has ratcheted up the fight against illicit financial flows and have used the proceeds of those illicit assets that are returned to fund the social sector, the social protection program and all of that. They are all provided in the budget at an average of 500 billion every year. So one would hope with the oil resources dwindling, government will be moved more to invest more in efficiency and invest more in tracking the leakages, and you continue to use the proceeds of that returns to fund the social sector. There is also what the COVID-19 crisis has brought forward, which is the whole idea of seeing supply chain management and control as a national issue that should not be outsourced to the so-called countries where they are produced cheaply. So things like vaccine, things like generic drugs and all of that that we used to run to India and China to import, one hopes that they will start making them locally here, and that will be an opportunity for impact investors across the spectrum, from those who don't want any financial return to those who want market rate return, to see it as an opportunity to invest in improving healthcare. We have all talked about the healthcare crisis here, both in terms of infrastructure, but also in pressure testing our healthcare system, stress testing it, whether it can withstand pandemics of this nature. These are all opportunities for investors to come on board. But what would make the positive outweigh the negative is whether the government of the day is actually conscious of the ramifications of this crisis. And by so doing, set up people in the government departments and also private sector that will help it to come up with the right policies. We're talking, Nick, I was talking about what Rwanda and Kenya is doing to help them ride on this crisis. And the question that has not been answered is, what is Nigeria doing? We have all kinds of committees, both the presidential advisory one, the vice presidential one, and the new one. They've brought the vice president to come. They are not communicating to us and with us what they are doing. So this is the time for civil society and all actors, I tell you, even the private sector, from enlightened self-interest perspective, need to engage government beyond transactional relationship of how do I have a personal access to the new chief of staff, to look at sector-wide approach, because when the hemorrhage gets out of hand, it impacts everybody. So why can't they work together? So it calls for more concerted approach. So in summary, there are positive, there are negative, but what will make the positive outweigh the negative is the consciousness that we are indeed in a crisis and we need to put our best foot forward.
I mean, that's a lot to think about. That's a lot to think about, especially when we think about the fact that one of the things you brought up was the fact that we're really in a crisis and how we can use this as an opportunity. And I'm not sure that we're seeing that at any level. The last question is also for Nneka and Innocent. It's quite a long question. This is from Ime Joseph Udobong. There has been a gap between the rural dwellers and those in cosmopolitan areas throughout this pandemic in each region of the country. How can this gap, real or perceived, be closed practically after this pandemic is over to help forestall a reoccurrence?
I can start. I think this calls back to... Oh, yes. I can start. I was just saying, I think this goes back to what Yemi was sharing about this identity question and how we are counting our people. Do we know where our people are, and are we comfortable with the knowledge of that data? So I think the question of not really having recent census data comes into play with this. And I think it also comes into play this question about how visible are people living in rural areas to people who are making decisions. I think what we've ended up seeing is there's a lot of community-based philanthropy where people are coming together for their villages, for example, where people are doing sort of small group fundraising and support. But I think there's a question about how sustainable is that, and how can we actually find ways to attract other types of capital to support with that kind of gap. And I think there is an interest in better understanding what's happening in rural areas, and we've seen that in a lot of the work and the studies that we've done. But a lot of the challenges that are facing people in rural areas are also affected and happening in cities. And so I think there's a question about how do we really address poverty writ large rather than necessarily a rural-urban dynamic only. So I think there are differences in the data that we're seeing in terms of how people in rural areas and urban areas are looking at data, how they're responding in terms of their basic needs during this time period. So we need to understand what's happening in the different areas, but I don't know without further data and more accurate data if there's going to be a really way to close the gap. I do know that as I looked at what was happening around the Al-Majiri students being sent back home and even across the border to Niger, I think there's a big question about if people fully understand the ramifications and repercussions of these types of actions, where people are being sent back to villages having come from cities, for example. So I think we need to better understand how to reach rural areas, but the biggest way we can do that is through identity and through functioning digital financial services, which we just don't have right now. And people in urban areas need some of those same types of services. So I struggle with saying we should have a very clear rural urban separation, but more so that there's a range of services and a range of investments that are needed to serve people who are in poverty regardless of location. And there's a big question about sort of the difference of resources that are in urban areas versus rural areas. So questions like we've been asking around internet access across the country, or network access in terms of telecommunications, those definitely we'll see very big differences in a city versus in a rural area. So there are some structural issues to invest in, but across the board, I think it's the disorganization that was mentioned is really across the board as we think about our approach to poverty reduction.
Yeah, so if I can come in here, I actually see a tremendous opportunity that this pandemic has offered in terms of finding more durable and sustainable ways of connecting our rural areas and the cities in terms of services. And one of those is that, you know, certain services in the past that we used to see as luxury services or one made for the elite, things like internet access, things like renewable energy for rural areas, should actually be seen from how they have impacted this pandemic as public goods that should be made available, and that government should find a way of collaborating with the private sector to make them, because they make the difference in this. Many of us are involved in some palliative donations and distributions in our communities, and only those who have phone lines are able to communicate and get this thing across. So what stops? I mean, while we are on this conversation, I have lost electricity, but because I have this MTN renewable energy solar bus, it's quickly, you know, transited to it without anybody here noticing. We can also have internet in a bus, and that will radically reduce the cost of rendering services to rural areas. Whether it's in health sector, where we spend 80 to 90% of our health budget building hospitals, brick and mortar institutions, and hardly having up to 10% to address the real needs. With a functional internet access, we don't really need all these gigantic primary healthcare centers. I can stay in a city, a doctor, a nurse can stay in a city and pipe healthcare services to anybody anywhere in the world or in our rural areas that they are. But these things requires backbone investment, infrastructure investment. We missed a huge opportunity when we were licensing these telecom institutions, where we raised $1 billion that could have been used and invested in laying fiber cables across the country. Right now, what is delaying laying of these fiber cables across Nigeria is what they call right-of-way charges. Last week, we had the Ekiti state government radically, you know, crash it to 145 naira per kilometer on. Why can't state government, through their governance forum, say, we are going to waive this for investors that will lay these cables and will make it possible for our rural areas to attract, you know, to have access to this. The same thing with impact investment. Before, we didn't used to include internet access and all of that as actually impact investing. Now, looking at the difference they can make in piping services to rural areas, we should broaden our definition of what is impact investing to include all of these services that improve the quality of lives of those living in the rural areas.
Thank you, Innocent. We're running out of time. I'd like Yemi to have a final word, and then I'll hand over to Maria.
Right. So I guess my own final word would really just to echo a bit of what Innocent has said, and that regardless of how we slice and dice these issues, it all comes back to leadership, and in this particular context, political leadership. So if we waste this opportunity and what this pandemic has taught us about, not taught us really, shown us the sort of real effects of the fact that we have not invested in our people and invested in infrastructure, sort of development infrastructure in the country, and then begin to take deliberate steps to correct that, then it would have been a waste. And that's why Lagos says we probably won't peak till August. WHO is saying that it will be with us till 2021. That if we understand that this is not, in a sense, not post-COVID, that we need to understand that if we don't, it's not post-COVID that we're going to fix primary healthcare. It's not post-COVID that we're going to start laying fiber. Innocent talked about Ekiti. It was done during this period. They had made the announcement during this period. Now, to get to Ekiti, you have to go through Ogun and 2 states, I think. Ogun and Ondo, I believe, or Ogun or whichever one. So even though Ekiti as a state, it's landlocked, as reduced its cost by kilometer, anybody who's bringing fiber from Lagos or from the port has to go through these states. So it would really not be effective if I still have to pay 5,000 naira per kilometer or 10,000 naira to go through the states to get to Ekiti. So again, political leadership is really key. And for those of us on the call, I really encourage, as we think about what it is that we invest in and the types of projects that we're looking for, it's really ultimately, how do we begin to change how citizens and society understand the importance of governance? No matter how much we pour into health mitigating things or education mitigating projects or programs or stuff, if we are not changing the base of which these things lay, we will continually need to mitigate healthcare. We will continually need to mitigate education and access to education if the body, i.e. government, that has the capacity and the ability to do it at scale is not delivering on those services. Thank you.
Thank you. I think for me, one of the things that has come out is really this thing of accountability, planning and coordination amongst the various tiers, and also coordination amongst both the private sector and government. Thank you so much, all the participants, Innocent, Yemi, Neka. This was really interesting. And thank you for the participants as well for the question. I'll hand it over to Maria to just close, because we're really running out of time. Thank you.
Thank you very much. I'd like to thank all the speakers, and thank you, Uloma, for hosting, for moderating. Today has been a very engaging opportunity for us to hear the insights from our speakers. And thank you very much for sharing your insight, participants. What I got from all of you is around data, the importance of data in identifying the poorest and the most vulnerable, which we do not have, and going forward, the need to build a database that can identify or capture this category of people. And going forward, there'll be a need to unify all of this data, such as the BVN, NIMC, voters register, driver's license, which allows for a more credible identification of people across the country. Another insight, which I also got from today's conversation and from you participants, is a more coordinated response and collaboration with the private sector and the government, and call for accountability. So this is a great time for us to call the government and engage with the government to be accountable at all levels. Thank you. Please keep your comments coming. Please share your insights even after the program. It will be very important for us to have those insights. I want to check if you're still there. So let's go to the chat box again and click on Mentee, and let's have one more feedback from every participant. And the code for this is 574209. I'll type it and I'll leave it on the chat box, 574209. So let's get that open. Thank you very much for staying with us. So let's do just one more exercise before we leave. And I'll share my screen. Tell me 1 second. Okay. I'm going to share my screen now. I need some feedback from you. Great. Great, great, great. So I'm seeing comments like fulfilled, needing action, insightful, felt engaged. Keep it coming. Call to action. Yeah, I think we need more action. Stimulating, engaging, rewarding, informative, enlightening, educative. Okay, thank you. I'm just gonna stop this now. Thank you very much. So I'd like to say some vote of thanks. I want to thank the moderator, Uloma Ike, and the panelists, Nneka Eze, Yemi Adamaleku, Innocent Chukuma, for sharing your insights. I want to thank also each and every one of you for joining this webinar. We at IIF want to move from talking to actually taking actions to provide practical support to the impact investing community and beyond. The COVID-19 crisis gives us this unique opportunity to take decisive steps towards promoting impact investing as a more sustainable way of channeling impact funds towards tackling the pandemic. So please follow us via our social media handle at IIF Nigeria. We'll be sharing more information about our work, especially in response to the COVID-19 pandemic. Thank you again, ladies and gentlemen, and let's keep the conversation alive. Thank you, everyone. Bye for now.
Thanks.
Bye-bye.